Today, we're getting under the hood of Naoko Kita, a daughter, sister, women's advocate, a healthcare and femtech innovator, and a founder on a mission for women's health literacy from Japan. She is the founder and CEO of Joconne Inc. from Japan. Joconne is a company that aims to create a society where women can live with enough health literacy. She strives to improve women's health literacy and empowerment in Japan, where the gender gap ranks among the lowest among developing countries. In Japan, women's health has been long considered taboo, to the extent that even recently, when buying napkins, people are putting them in opaque bags to hide them. After working for global medical device manufacturers such as Johnson & Johnson and Medtronic, she changed her career after experiencing endometriosis and realizing her mission of increasing women's health literacy. Along the way, she also experienced pregnancy and childbirth and started her own business just 1 year after giving birth. She has been selected for various entrepreneurial programs in Japan and received an Outstanding Leadership Award at the Health 2.0 International Conference. Wow, welcome, Naoko.
Hello, thank you very much for Elizabeth. It's a great introduction.
Well, I'm so excited. You know, what you're doing is so important for the women in Japan and, of course, beyond. And so if it's okay, I'd love to get going. So the first question I have, Naoko, is, what was that inflection point in your life that really pointed you into healthcare?
I have started my career from the global medical device company, as you mentioned. So Johnson & Johnson, Medtronic, Abbott, but I was in graduate school for engineering. My thesis was about the artificial bones, material of artificial bones. So, but I didn't have any intention to go to medical healthcare industry. My husband, who is the classmate of university, said it looks like the really natural course for me because I have several healthcare professionals in my family or in my relatives. So it's really for me, it's very close. The medical healthcare is very close from when I was a child. So that's my the starting point.
So I'm curious, and thank you for sharing that. Can you take us on a journey and share your experience? We talked about working at J&J and the device company. Yeah, share that.
Yeah, actually, that was a great experience for me. I enjoyed to work there very much. And then I worked with the colleagues, not only from Japan, from global, United States, Europe, other Asia countries. So I really enjoyed to work with them. And then also I worked in cardiac surgery marketing area. And then I really kind of closely work with the world's leading cardiac surgeons. So that was such as the great experience. But I think the United States in the same situation and other countries it's a similar situation. But in Japan, cardiac surgeons are really male-dominated society. And then that means the sales representative of those companies are really the male-dominated good team. And then I was marketing professional and then work closely with sales team. So that means I was only women in the group. So I didn't share about my health condition, period of pain or period any problem. And then so business trip to United States, and then my colleagues was all male, customers are all male. And then if I was in the period and then I had period pain, but I just be patient with a painkiller. So I could not share about that with anybody. And then it's really tough for me. It's getting tough for me. And also around 30 years old, I really gradually feeling the glass ceiling in my career. So in the company, men who it looks who don't have great performance, they got promoted quickly, and then I stay at the original position. So I really feel some there are some glass ceiling, and then I live in the kind of gender gap society. So I recognize that, and then that was even before my pregnancy. So I could not imagine like my life with like working in the same situation and then with like have like the family things like the have baby and then raising kids. So I feel like the really like uncomfortable for that. And finally, I was diagnosed with endometriosis, and then that was a result to be patient with painkillers. If like I was surprised if I know like about endometriosis and I know choice of like the low dose pills. I don't get into this situation. So I was very shocked. Like I don't have any knowledge about my health and then I didn't know about any my choice. So this situation is not like sustainable for my life. So that's like my situation in the medical device company.
So, well, thank you so much for sharing that. And that must have been really hard to be at a company and feel really invisible. And then to also be suffering with period pain, which, with endometriosis, not knowing you had it is just can be so debilitating. But if you're in an environment where you don't feel supported, I mean, separate of having a glass ceiling, you're just not supported. That must have been really brutal. So I'm curious, I mean, because you just made an interesting comment at the end, which was you realized had you had known that if you had taken the pill or whatever, that could have been helpful for relief with the endometriosis. Was that sort of what got you? Was that moment that got you to go back to study health literacy?
Yeah, I back to my like the school to study health literacy after my experience of endometriosis. Yeah, as a woman, and then like I should know about my health, like have a choice to prevent my risk. But I didn't get to know that I didn't have any chance to get to know those like the knowledge. That means like the public education is not ready for that. So I really like wanted to study about health literacy and then change like the people's like knowledge, intention, and also like some cultural social norms.
So I'm kind of curious. So you go back to school to study health literacy. So you probably have a strong point of view on the women's health landscape in Japan. Do you want to share that?
Yeah, actually, as I mentioned, there is a still strong gender gap in Japan, and then Japan is 125th among 146 countries. So it's really like the huge gender gap. So it's very far from gender equality. That means like there are strong sex roles in the like the people's mind. Men should work outside, and then women stay at home and then care of like family things like child care or like the elderly care. So and also like the period and menopause is kind of like negative things like the to hide like for example, like to go to like the stores, if I go to stores, like the store staffs like to put napkins and tampons in opaque bag. That means like the napkins, tampons are like the products like the should be hidden. But it's really normal thing. Like the women like have period, it's natural thing, and then like the many women like need like napkins, tampons, but it's like the opaque bag. It's really strange. So that's like the Japanese women's health situation. So like the women cannot talk about period, menopause, publicly, loudly. So that was the situation. But actually, it's gradually changing. So as United States, Europe, other countries, femtech is like the booming. In Japan, it's like from like 2021. Also, like the Japan is facing like the population decreasing phase. So like the government actually really pushed like the women to continue to work. For like women's empowerment in workplace, then like the government or company like the notice to like treat women's health is really important because like the women continue to work, then like the women go through menopause age, like that's during like their work age. Recently, like the really moving, and then so it's really changing. That's the situation in Japan.
So tell us about like what motivated you. I was excited to announce that you have a company called Joconne. What motivated you to start your company and tell us about it?
Studying health literacy So in the beginning, I thought it's health literacy is about like the individual's knowledge or intention for health, but actually I recognized like the environment is very important because like the when women want to do something for their own health, but there's no like the environment for access products or services, then like the women cannot do anything for their own health. So then that means like their health situation is not changed. So I recognize the environment is very important. That means like to create environment. That means like I cannot do like with individuals. So like I decided to like have company to prepare like the environment for women to like access like the product services, their own health when they need it. That's my story for starting my company.
So what did you launch with and what are you doing? What is Joconne doing today in service of women?
So in the beginning, Joconne started with like the training for women, like about pelvic floor muscle. You may know like the pelvic floor muscle is very important muscle for women's health. Like when like weaken this muscle, it causes like many problems like urinary incontinence or other problems. But in Japan, still like the not many like physical trainer or physical therapist who can treat pelvic floor muscle to access those trainers therapists like if like women are lucky then like they know somebody can treat like the pelvic floor muscle, but like normal women don't have access for those like the specialists. So I want to improve this situation. So I connect like the physical trainer, physical therapist who can treat the pelvic floor muscle, and then women who need it. Because like as you mentioned, like I was just after 1 year from like my baby delivery. So I really, the timings, I really needed this training. So that that was like our first service. Then, but I still like I'm waiting for like to increase women's like knowledge and intention to treat like the pelvic floor muscle. And they actually quickly growing like it's like the companies services. So many companies started like the support women's health for like their employees. So starting programs like the healthcare seminar for women's health or some programs to support women's health. So like we provide like we support those companies to like improve like the women's workplace. Also like we do some like the support femtech like the company femtech business development. And also in the future, I want to really support, I eager to support like the femtech, like the company or startups in the abroad to come to Japan. Because I went to like the women's health conference in Europe in this year, and then I really felt like a difference between Japanese femtech and then world global femtech. The Japanese femtech is still like kind of fem care, like the cosme or like shorts or something like that. Looking at global femtech, so it's really tech. So like to improve like the diagnosis of women's like the disease or to improve like the treatment of women's disease, really close to like the medical. And then actually that's like my strong back, I have like the strong background for that like medical device market. So I wanna like support those companies to come to Japan and then provide like those like the environment Japanese women can access like those like the products or services.
You made the comment that, it was 1 year after you had your child that you were experiencing, pelvic floor dynamic. Pelvic floor muscles are critical because, they're critical. So I think that's fantastic that was sort of the first offering that you offer to the women in Japan. So thank you for sharing that. I'd love to know, you spoke a little bit about what you see, having women come over and having companies come over to Japan. How do you imagine femtech and women's health 5 years from now?
So in 5 years, 10 years, it's like something changed and something still like the same. But I believe like there are like the more choices for women and then improve like the whole like the environment for their health. And then people like of course like the women's themselves, but like the people like the surrounding them, like the management people or like the families understand more about women's health. Actually, I believe like the women's health is like the entrance of diversity. So women have like the various symptoms, like for period or like menopause. And also women is in the various situation, like the family situation, like the child care, parents care, also like the working environment. So like the women, that's all like the in the various like the situation can have a choice and then live better. That means like the doors for everybody like the open, live better. So like the any like the health limitation or like the any like the people who have like the gap like sexual minorities or like the disabilities. So it's like the more diverse society and then like the many people can live easier. So that's I hope.
So I think that you're on a track that is going to really provide so much in so many ways. You're doing good for humanity, good for women, good for men, because when women are healthy, everybody's healthy. And then, of course, good for the economy. I mean, I think that that's critical. And so I think that that's fantastic. The more educated we are. But I think the other word, which I like, well, a couple of words. I love the diversity. I love looking at all, accessibility. And also the comment, yeah, so you said diversity and then you said making things more accessible. But really, the one word that stuck out for me was choice. Because the more women know, the more educated we are about our own bodies and every aspect, the better educated, the better choices we can make. Just really understanding the health literacy gap, the gender gap. Educating men is equally as important because they don't understand and know about their partners, their colleagues, their daughters, their relatives, their families and friends. And so all of what we're doing is really going to make a difference. As we come to a close, and I don't know if there's anything else you want to say about what you're doing as it relates to Joconne or women's health in Japan before we get to the last question.
Funding from the mail is really crucial. So like the healthcare seminar for about women's health in the company. Actually, like a couple of years ago, it was only for like the women. But like recently, like the company, people noticed like the understanding from like the male is really crucial. So like they will switch to like the include everybody. And in the beginning, like the women cannot like the talk about their health or like if like the men are there, but like the people's mind is changing. So the people like from the what they try and then like they improve. And then recently actually like menopause is really like the kind of like the spotlighted when we like the government doing like the women's health research and they started to include the men's health like the men's like the menopause or like the other like the healthcare issues. So it's kind of like the become like the inclusive, the diversity. I really like the see like the society like the it's really diverse.
I did want to address one other thing, which is you mentioned the caregiver who's so busy. And I talk a lot about that. I've done so much work on that, but the caregiver who's so busy taking care of everybody else. They take care of their children, their aging parents, their friends, their relatives, their spouses or partners. And so they're very dismissive of their health. And would you say it's the same in Japan?
Yeah, right. Yes, yes, in the same in Japan. So like the women take like the main role to care like families, so like the child care, also like the parents care. And then actually it's kind of like the unpaid work. So like the people recognize not like the important or like payable work. So that's very like the disappointing. So those like the works really like the important and then should be like the more like the created very like the high position in the society. But it's really like the low position. In Japan, it's like the caring people's salary is really low. So sometimes like the child care staffs, the salary is low. So the most of them are like female women. And then if like the men work in the like the other like the child caregiver, then like it's not enough. salary to like the support like family economics. So that those situations should be changed. It like those like the works are like very like the should have like the respect from the people, and then like the economy ecosystem should be there.
Yeah, I think you're right. And I think, as you were saying, it's just like the more we come together and are more inclusive in every aspect of this understanding around health literacy, the better our societies will be. And so, I mean, maybe Japan, might be at suffering in a greater way than we are in the US, but we have plenty of problems here as well. And I have one last question for you. I love this question because it's your opportunity. You have this platform to give a message to women around the world of all ages, of all cultures, and all backgrounds. What do you want to say to them, Naoko?
So my last message is like for women and everybody, like I want to say like your feeling and voices are very important because we live in the society culture of like the very have like the very like the unconscious bias. Like when we feel like the women feel something weird or uncomfortable, that's a true like the in the like unconscious bias like society, it's like it's not visible, but we have to like make them visible. So like your voice and your feeling is really important. And then this like a very small step. So like the share somebody like share with your friends or share with your social media. That's like the very small step, but like it will change the world in the future. So like the Me Too movement, we have like some tools to like the share with somebody and then to make big movement. Women in global should be connected and build those like the hidden programs and then make better world. So that's my message. And then thank you very much for Elizabeth to invite me to this great podcast. Thank you very much.
Thank you so much for getting under the hood with me today on your story. And I love that close and that message, really being aware of unconscious bias and making sure that we have a voice. I think that's really important.
Thank you very much.
Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, YouTube, and LinkedIn so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood LLC and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Matt Butler, and edited by Matt Butler. The music is by Ayla Schaefer. Her song, Rose.